Today we are going to see how to run a test on a POCT analyzer. So I am going to tell you what are the things we require to run the test. This is POCT analyzer. This is incubator. This is test cassette and buffer. So this is HbA1c cassette, and this incubator is for incubation of cassette as well as buffer. This is 100 microliter pipette and 5 microliter pipette, tips and tissue paper to wipe. So one thing what I am going to do is, if temperature is more than 30 or it is more than 28, then you have to preheat the buffer and a cassette. So I am putting this buffer and cassette for the pre-incubation for 5 minutes. So we will wait for 5 minutes. Once 5 minutes completed, then we will start the test procedure. So while we have put buffer and cassette for preheat, we will save the calibration. So if you see, this arrow shows in this way we have to insert the ID chip. So I am inserting it now. ID chip has inserted. Now I will click the read ID chip. Your calibration has read and it saved in the instrument. So calibration is same. Now if you see, I have two pipettes here. This is 100 microliter. This is 5 to 100 microliter variable. This we required to add the sample into the buffer. The volume is different as per the test or as per the respective test. It varies from 5 to 75. This is 100 microliter tip. This is used to pour the mixed solution, that means serum and buffer or RBC and buffer, that we will take 100 microliter and add into the cassette. So if you have two separate pipettes, that is best option for operation or best option for easy operation. So 5 minute incubation completed. So that is preheating is completed for cassette as well as buffer. So now we are running the test. So we have taken a buffer. Now we are taking 5 microliter RBC for HbA1c. This is already mixed. Now I am taking it. You have to wipe it. Now mixing. Once this is done, you have to mix it for 1 minute. Once 1 minute completed, we will take 100 microliter from this solution and we will pour it into the cassette. Now 1 minute completed. Take 100 microliter, pour it and put it for incubation. For HbA1c, incubation is 5 minutes. Now after 5 minutes we will take the reading. So now 5 minute incubation is about to complete. Once 5 minutes completed, it will give beep as well as it will blink. So I am removing it and now I am going to take the reading. I will click start test. First time it will ask what is the sample type, so I have to select whole blood for HbA1c. You will get the result. As you can see, the result is 5.44. This is our result, and now I will show you what is the result on a D10. So you can see D10 result is 5.4 and we got 5.44. So this result is exactly matching with the D10. Thank you. I think once you follow this procedure, then you will get, every time you will get the good results.